If you can see the screen, you
Yeah.
can see the screen? Yeah?
Yes, I can.
Okay, so 312, is it? The three 3 minutes and the 12, your
3 minutes
exam, yeah?
and 12,
And 12,
yes,
yeah?
yeah.
Okay. Okay, so shall I start the 3 minutes?
Yes, please, yeah.
Yeah, sure.
Okay.
Happy to start?
Yes.
Go ahead.
Hello, my name is Dr. Muhammad. I'm one of the doctors at the surgery.
Yeah, hi, doctor.
Hi. Can you please confirm your name and age?
Well, I'm Emily and I'm 15 years old.
Hi. So, how can I help you today?
Well, to be honest, doctor, I'm not sure. Well, I guess my mom did arrange that appointment. She's just keep worrying and she's saying that I'm losing my weight.
I see. Okay. Well, thank you for coming in today to see me. Well, first of all, do you want anyone else present in the conversation?
No, not really. I'm fine like that.
Okay. So you've mentioned that your mom is concerned about your weight loss. Is that something that you share as well?
To be honest, no. I do appreciate that she's worried because I know that I lost some weight. Okay. But I can see it's massive, and to be honest, it's not bothering me.
I
So
see.
I'm not sure why she's bothered.
Okay. Okay. So would you like to tell me more about your weight loss?
I think I lost 1 stone over the last 2 or 3 months. You know, it's not that massive. I mean, when I have appetite, I do eat.
Okay. And so with regard to the weight loss, is that was that planned? Was that intentional?
No, to be honest, it just I lost my appetite. I just don't fancy food. I guess, and that's why maybe I lost weight. But I'm not like restricting food because she's keep worrying that I'm restricting food. I don't, doctor. I'm always satisfied with my own body. I don't need to restrict food.
Okay, okay, I'm happy to know that. So, um, sorry, again, I just want to understand more with regard to the weight loss. You mentioned that it's not intentional. What about your feeling about the weight loss? Are you happy with the weight loss?
No, well, I'm not neutral, doctor. Not happy, not sad. I mean, it didn't bother me at all.
Okay, I see. Okay, so coming into the appointment today, do you have any expectations? Do you have anything that you're hoping for me to address?
Well, not really. I just want my mom to stop worrying.
Okay. Yeah, we can definitely address that. And also, as you're mentioning your mom's worries, are you concerned about anything? Anything that you want to share?
Not really. Really, I'm fine, doctor.
Okay, I'm glad to know that. And do you have any idea what might be the reason behind your weight loss?
It just I think I lost my appetite.
Okay. Okay, so losing your appetite that can be due to various reasons, and to be honest with you, it's quite concerning losing a stone of your weight. Do you have any idea what might be the reason behind you losing your appetite?
I'm not sure to be honest. But generally I feel fine, doctor. Even I've because I started reading about appetite and all of these, and then they said if if that didn't affect your general health, I mean that's fine. Maybe because I'm 15, I'm now growing up, maybe more quickly, something like that, and with the hormonal changes, I think this what I read. Okay, that can lead to some weight loss.
I see, I see. Okay, it seems that you've done your research about the matter, which is really commendable. With regard to the hormonal changes, can you elaborate on that?
Well, when you are transitioned from being, a child to become a woman, so I guess, yeah, I guess I guess that the cause maybe.
Okay, okay. So would you mind me asking about your periods? How is it?
They are regular. In the
Okay,
beginning, they was erratic, but then I think after 6 months or 9 months, they start to become regular, and I don't have any issues with them.
okay, that's good to know. And when was the last time that you had your period?
Just now, just finish it, be 1 week, around 1 week. I'm always having an app, and I'm following through the app, so the app is always saying it's fine.
Okay, okay. So going back to discuss your appetite, when you're saying losing your appetite, can you give me a rough idea about your diet, your daily diet?
Well, I never skip a meal. I'm always taking, a breakfast, lunch, and dinner, but maybe the quantities is decreased. Okay, so maybe in the breakfast I will eat, a porridge, and then that was, big plate. Now maybe half plate. Okay, and then in the dinner time in the lunch time I will take maybe ham sandwich and cup of tea probably, and then in the lunchtime I will eat a chicken. Then so now I eat only half ham sandwich, and then um, maybe a little bit of rice, and the chicken is just a piece of a chicken, very small piece.
I see. Okay. And with losing your appetite, losing your weight, have you had any palpitations at all?
Sorry, what position? What you mean
Sorry,
that?
like have you had any heart racing? Have you feel that your
Oh,
heart is pumping?
no, no, no,
Okay. Any chest pain?
no, not at all.
Okay. Any profuse sweating? Any increased sweating?
No.
Okay. And how's bowel opening?
Well, I'm quite regular.
Okay. Any watery stool at all?
No, not at all.
Okay. That's good to know. And also about the neck. Any pain in your neck at all?
No, not at all.
Okay. Okay. So in general, are you well and healthy?
Yeah, I guess so, doctor.
Okay. And passing urine all right?
Yeah, sure.
Okay. And also about your exercise. Do you exercise at all?
Not really, doctor. I'm a lazy type of person. I don't like, doing a lot of physical activity.
Okay. And can I ask why?
No, that just a habit. I'm not. I would stay, doing chatting on the, on the phone or watching movies in the, YouTube rather than, going to do physical activities.
Okay.
That's a habit.
Okay. And do you go to school?
Oh, sure, yeah, doctor, yeah.
Any concerns at school at all?
No, not really. I'm happy with the school. I mean, I have a lot of friends, and I guess I'm fine. Maybe my grades started to just to drop a little, and my mom is worried, and my CGS exams are coming, so I
Okay.
hope it will be
Hmm.
fine. I'm not sure.
So you're quite busy. Okay. So have you discussed with mom why she's worried?
I guess about my my school performance probably, and she doesn't like maybe some of my friends probably.
Okay. Um. Okay. Can you tell me more about that?
Well, I have a boyfriend, doctor, that she's not happy with.
Okay. Um. It might be a sensitive topic, but if you please tell me more about that, that might be relevant.
What you would like to know, doctor?
Okay. So when you're saying a boyfriend, can you tell me like about the relationship? How old is your boyfriend?
He's 17. Now we know each other like maybe a year.
Okay. Are you happy in the relationship?
Yeah, yeah, I'm happy, doctor. And don't think like her. We are not sexually active. It's not about sex.
Okay, so thank you for answering all my questions so far. Um, so to be honest with you, Emily, the weight with this kind of weight loss, the fact that you've lost a stone over 2 to 3 months, I'd be concerned about how your weight is at the moment. Do you know when was like, your last weight?
I'm not getting the question, doctor.
So do you know what is your last weight? Your recent
Uh,
weight?
oh, my recent weight. Well, so I was around 50 kilos, and now I'm around 42 kilos, probably.
Okay, okay. Yeah, so I think we need to further investigate that. We need to understand the cause behind you losing your appetite and losing weight as well. Do you agree?
I don't mind, doctor. If you would like me, um,
Okay.
I'm happy with whatever you suggest.
Okay, thank you. So I think the best course of action is to ask you to come for a face-to-face appointment. It's just to examine you and to do your vitals as well. Are you happy for that?
What you would like to examine, doctor?
Mm. So I'd like to examine your vitals in general, which would include your blood pressure, your pulse, and your oxygen saturation. I'd like as well to examine your abdomen and to examine your body in general to see if there's any lumps and bumps anywhere. And speaking about lumps and bumps, have you yourself noticed any lumps and bumps anywhere?
Mm, no, not really.
Okay, okay. So are you happy to come for a face-to-face appointment?
Yeah, sure, doctor.
Okay. And do you mind if we have the face-to-face appointment with anyone that you any next of kin for you, for example, your mom, just to get more comprehensive understanding of
Yeah, I'm open with my mom. I took frankly. I can bring her with me. I don't mind.
Okay, perfect. Thank you. And also, we might need to do we need to do some routine bloods, and that will be full blood count. Will do the blood for the thyroid gland, which is the gland at the neck. Sometimes if it's overactive, you might get that weight loss.
Hmm.
Okay,
Sure.
and yeah, and we'll do some electrolytes. We'll check for the kidneys and the liver functions as well. Okay.
Yeah, sure.
Okay. And would you mind as well me referring you to a dietitian just to help you with some diet advice?
Yeah, sure, doctor. It's finished, but you continue. Let me see how you will end it.
Um, yeah, so referring to a dietitian, which is would give you some advice on how to uh, how to take your diet, and it's just to yeah to just to reinforce the diet advice for you.
Okay. uh,
Okay.
That's fine. Although I'm eating, but that's fine, doctor.
Okay. Do you have any questions for me so far?
No, no, not really, doctor.
Okay. And yeah, I might just add a few questions about body shaming, bullying at school.
Okay, yeah,
Does she look to herself?
yeah, yeah, no, let me listen to you how you are phrasing it because that's
Okay,
important. You continue.
okay. So a few more questions with regard to regarding your weight loss as well. Are you happy with some people would aim to lose weight because they are not happy with their body shape? Is that something that you experience?
No, doctor, I'm very satisfied with my own body.
Okay, I'm glad to know that. Also about school, is there any bullying at school at all?
No, no. I'm very friendly at school, popular, and everyone like me.
Okay. Yeah, thank you for answering all my questions.
Yeah. Any safety anything?
I would, yeah.
Don't finish your case without specific safety specific. Okay. Put
Mm,
multiple dots below specific safety netting and the specific follow-up plan.
got it. Yeah, so in the meanwhile, until we see you face to face and do the bloods, in any case, if you experience any heart racing, any worsening weight loss, any chest pain at all, then just call 111 or call us right away. Okay.
Sure, sure, doctor. Yeah,
Okay.
will do
And
that.
yeah, I'll add to that any dizziness as well, if you feel any dizziness.
Sure, sure, doctor.
Okay.
Okay, well done. Okay. Um, Before giving you your specific feedback, I will just give you a general hint about the case, okay? Um, so mainly when you have a case with a differential, okay, or a symptomatology, okay? I'm always saying symptomatology mean differentiology. So it means if you have a symptoms, it's very difficult unless if you have a very positive investigation or positive clinical finding will
Mm,
guide you to the diagnosis, okay? Whenever there is a symptoms, you need to mention some differential. You did some differential, but was not enough, okay? And I think that's why the you missed a bit of the key important points in the questioning. So if I'm thinking about teenager losing weight, I will consider physiological, okay, or pathological causes and psychological causes, okay. So
yeah.
physiological, as she said, rapid growth spurt because of her, becoming a lady, and then I will then think about meds. What is meds? Metabolic, okay, which mean diabetes, which you ask about, the urine. Okay, thyroid, okay, which you ask about, the being hot, I think, and the other is cold, and I will think about Addison, and then eating disorder, okay, and maybe digestive problem like irritable bowel celiac disease,
Yeah. Yeah.
which you did ask about the changes in the bowel habit, but was not enough. Okay, you need
Mm,
to ask more. Okay,
yeah.
and then chronic systemic infection. I didn't hear you asking about temperature, history of travel. Okay, any exposure to TBs. Okay, because there is people with
Yeah. It's
TB
very
still in the
relevant.
UK.
Yeah.
Yeah, And then also if there's any malignancies are running in the family, okay, if she's having easily bruising, okay, because leukemia is common in children, is not uncommon. Okay, and psychological, I will ask you about eating disorder, and what is important in that age group, okay, is substance of abuse. Okay,
Of course, yeah.
please, please,
Yeah.
substance of abuse. Okay, and that was crucial. Okay, substance
Mm,
of abuse. Okay, I did hear that you asked about, the fat syndrome or the Reed's syndrome, which was fine. Okay, and she was frank from start. She told you I'm lazy, so that will, and she told you also from the start, I'm fine with my body. I'm not restricting food, but I lost
yeah.
appetite. I guess so. She was helping. She tried to help because the differential is wide and wide
To,
differential, and it will take time to go through them. So
mm,
once the actor help you on something, you don't need to repeat it. Okay, you can just go through it. Okay. And then once you identified that there is a substance of abuse, because there is a substance of abuse in this case, okay, she will tell you I'm smoking cannabis with my boyfriend, okay, and she's 15 and her boyfriend is
mm,
17, okay, and then you need to explore if she's addicted to that or not, and then why she's smoking. That's important, so you can address that. Is that something is forcing her to smoke? If there's any abuse, okay, any grooming, exploitation, okay, or and if she told you she is sexually inactive, but then if she is sexually active, okay, you need to know if if she's practicing safe sex or not, yeah.
yeah.
And then I would ask about the symptoms of withdrawal as well, okay, and how often she's smoking the cannabis, and if there's any other symptoms, any other substance of abuse. Um, when you start to talk about cannabis and build the rapport with the patient, you need to what's called motivational conversational interview with the patient. So in order to build up or initiate with the patient to motivate her to stop cannabis, you need to educate her. Okay, so educate her what are the drawback of cannabis. So do you know some of the drawbacks of the cannabis?
Um, so dependency with social
Yeah,
withdrawals,
that's
weight loss
important.
would be one of it as well, isn't it?
Yeah, yeah, to be honest, weight loss or weight gain is different. Okay, so weight loss or weight gain, sometimes weight gain, sometimes weight loss. Okay, usually with the cannabis, people like to eat a lot of sweets. Usually, okay, so some people will have weight gain, some people will have weight loss. So in her situation, obviously the cannabis, provide her with the weight loss. Give her some weight loss. Um, what else? Which needed to be explored in that case. So there is something called bad trip, okay, and all the other and on the other thing also they can cause paranoids and psychotic feature, and that's need to be asked, okay. And the school performance already she said that it's going down, okay. And then you need to ask about cognitive impairment. Is she's able to concentrate? Is she able to revise? And then you need to give her some, warning points, okay, like that you might use in the future. You might use in the future about the illegality of these, at her age to smoke cannabis, okay, and then the criminal charges that can affect her boyfriend, okay,
Mm,
because he is giving her for sure the cannabis and bringing her the alcohol as well, okay, and also a small hint about that the safeguarding that you might use it in so in the management plan.
yeah, yeah,
Then physically, so the lung cancer, lung affection, okay, the panic attacks, decrease the growth, and then one of the YouTube channel videos was cannabinoid hyperemesis syndrome, which can
yeah, yeah.
affect her.
I
Yeah.
listened to that video.
You
Yes.
listened? Okay, that's good. And then you might in that age group, if you ask, just for the examiner or for the, listener to know that you are thinking about the connection, and also in the also gender dysphoria. Don't forget to ask about that, about
Mm,
alcohol, drug of misuse, as well as ADHD, okay, in
yeah.
the
So it's
family, and
It seems
autism
that
in the family.
yeah,
Yeah,
it's a lot to discuss in this case, and I think I went into the case. I was thrown away by the fact that
yeah, it
she's
is.
feeling well in
It is.
herself. She's not
Yes.
cooperative, but it seems that because we usually look for cues, but
Yeah,
it seems that this was the cue that she's
that she's yeah,
yeah,
exactly.
she's
That was the
physically
cue.
well,
That
and
I'm
I should
physically well, I'm
go into the
fine.
social bit.
Yes, exactly. That's why from the
Okay,
beginning, I'm really fine, doctor. I'm good.
yeah,
Okay, but my performance started to decrease. My appetite started to decrease, which towards the psychosocial bit of the consultation.
mm,
Um, once you explore that, because in the differential, okay, I will show you in the individual feedback, I will show you how to do, how you can, just, make it in a very fast way, maybe less than 30 or second, how to ask about the physical causes of loss of weight. Okay, so I will let you know how to do it. And then in the management bit, you will say, okay, thank you. Well, I guess, for example, yeah, your weight loss can be, yes, most probably due to cannabis, use, but also can be due to other physical things. I would like to do blood test. I would like you to come for, physical examination. And when you say physical examination, you need to say what you want to examine. Okay, okay. I would recommend you to do physical examination of eating disorder, please. Okay, so there is a specific physical examination for eating disorder people. Okay, and for sure the thyroid function, and don't forget also to look at any needle mark or abuse marks. Okay, so needle marks in the hands. Okay, or even self-harm, cutting
yeah,
marks, and
true.
also if there's any sign of abuse. Okay, and then in the management, okay, so after examination, physical examination, blood, you will need to put a plan for family support, which I like that you told her come in with your mom, because for sure the mom will need the support. Okay, might be she have also psychological impact on the mom. It's not an easy for the parents to see that their children are becoming more or less dependent on the misuse, okay, substance of misuse, and then the child, okay, try to signpost her, to the social services for sure, okay, and also the camps, okay, because she will need support from camps. And if you find out there is an abuse, okay, or exploitation, that will need to inform the police. um, do you think the school will have any input in that? Would you consider thinking, hell, shall I write to the school for further information, or, for example, or you would ask her for, tell her I will write for the school for any support, and what sort of support you are aware about in the hospital, in the school?
Do you mean after finding out that she's
Well,
abusing?
uh, I either after finding out, either now, so already that she admitted that she's smoking
Oh, struggle.
cannabis.
Oh,
Yeah.
yeah.
So
Not
is there?
specifically, to be honest,
No,
for
that is
school.
safeguarding. That's safeguarding because if you ask that boy was her boyfriend during the school time. Okay, yeah, he graduated, but still he know her from the school. Okay, so there is a school safeguarding officer. Okay, usually a teacher with
Hmm.
will experience it. Okay, and then also the school counselor for talking
So
therapy and the trying.
what if she was 17 years of age? Would we still go for the social services
Yeah,
and safeguarding?
yeah, I will still because she's still under 18. Okay,
Okay,
she's still under 18.
under
Okay,
18.
yeah, she's
Okay,
still 16 is the age of sexual consent. Okay, but drug of abuse and alcohol is 18. Okay, so if
18.
she's still under 18, so yeah, I will go. And the other number is 20 years old. So less than 20 years old is
Uh, not sure to be honest.
younger parenting. So if any lady that she's pregnant or male, have a relation and they started to build up a family, so below 20 they are young parents. Okay, and they have also specific pathways. Okay, either during pregnancy. Okay, it will be always consultant led, and also safeguarding, always doing support for this patient. Okay, so
mm,
any young parents, there is a lot of support for them less than if they are less than 20, either money or housing. There is a lot of support in the community. So always when they are less than 20, there is sort of pathways. Okay,
mm. It's good
and
to
if
know.
yeah, okay, that's for the building a family. So 18 for drug of misuse and alcohol, and then 16 is for the sexual
Six.
consent. Yeah. Okay. Some of the and then don't forget to her if she have any suicidal thoughts, self-harm, to go to the crisis team and how to contact the crisis team. And some of the charities, okay, that is responsible, let me just open that, responsible for uh, either eating disorder is always beats is my way to go, to be honest. Okay. um,
Sorry,
beats,
what's
yes.
what's beats?
Beats, you don't know beats? So
No.
beats is the most important eating disorder organization in this country. Okay. I will show you their their website. Okay. But for addiction, okay, we have addiction UK. I will show
Addiction
you.
UK, yes. Yeah.
Yeah, so
So it's beats. Is that B double
I will
E
show
T?
you. I will show you. Don't worry. Let me just to close the Word document. And although I needed to show you something in that Word, um, so let me first then. So there is this website was called Cannabis Addiction UK. Okay, which will show you all the centers for treating a cannabis addiction in your area. Okay, whatever you are in the UK, with through the postcode, they will show you what are the nearest available centers. And there is free chat. Okay, so the patient himself can start to chat with them. Okay, online for free. Okay, this is the first one, and then the second one is
Sorry, what was the name of the previous website? Is that Addiction UK or
Addiction UK. Yeah, Addiction UK, and the other one with you. Okay, I need to remove this. Yeah, here with you. We are with you. Okay. Also, they have an online chat. Okay, and the patient can, just self-refer to them. These are for the young people, okay, not for adult. And then young
yeah,
minds, then young minds.
Young Minds? Yeah, I know
Yeah,
Young Minds. Mm,
okay, young minds. So three. These are the three most common, to be honest. So young
yeah,
minds, okay, and then the cannabis addiction in the UK, and then we are with you, okay, with you, with you. We are with you. Okay, and then beats. That's for that's the most important, to be honest. If you need even to teach yourself regarding eating disorder, they have free webinars. They have um, a lot of self-learning, uh, and also beats eating disorder, where you can, even if you want to volunteer. Okay, they will give you courses, and then you can be part of the charity. So that's called
beats.
beats eating disorder. Okay, so very good. There are also chat room, helpline. Okay, you have one-to-one, one-to-one sessions. Very good, very good. Okay. If you have any patients have eating disorder, any food related eating disorder, okay, I advise you,
Yeah,
signpost him to read about it. He will learn a lot from that website. And you yourself, if you are free, probably after your exam, just to go through their events, training events. Training events is really remarkable, okay, and all of them are free, okay. So workshops are marvelous, and you will have CBD points, and all are free. Okay, and you can see workshop of ADHD because there is a close connection between ADHD and autism with the eating disorder. Okay, so that's why in this case also a drug of abuse, gender dysphoria, always ask about is there is any ADHD running in the family or autistic disorder. Okay, still the link is not clear. Okay, but most of the studies are saying there is a close connection. Maybe in the future, you know, we will know what are the connection is. Also, if you have a patient with mental health disease and young, usually I use the heads. So heads methodology and how to approach the patient, okay? Which you did it, but when you are doing it haphazardly without
Unorganized.
specific
Yeah.
unorganized, you might have a risk of losing the
Yeah.
questions. Okay, there will be separate videos inshallah in the future about heads and how to go through it, but basically it will be home situation, education, how it is. Okay, if she have any other activities, hobbies. Okay, because you need to involve her more in these hobbies and she give you a hint, I'm lazy, so you might
Mm.
consider what you think. If you can you do any sort of hobbies, do you there's something that you love, so that will help her, to just be away from the bad company that she is involved with. And then for sure drug and alcohol, suicidal thoughts, emotion and behavior. And then when you discharge her, there should be safety discharge plan. And in the future also we'll give some example of the safety discharge plan. So that's the case in general. Do you have any question in the case?
No, it's just I was thinking about the exam, and because usually as I was talking, look for patient would feed us cues. In that case, it was really difficult to pick up on the cue. But it's as you've put it. She said that she's physically well, and a teenager should have asked about social and any substance misuse. This is for sure. But I was just asking. I was just thinking, what should have asked for her to open up? So maybe like a question like, what do you think has changed in the period that you've lost weight? Maybe that would have made her open up. Like,
No, the main issue that you need to put in your differential that alcohol and drug of misuse is what, not alcohol per se, is drug of misuse because alcohol will later, maybe will later increase her weight more. Okay, but the drug of misuse is one of the differential of loss of weight in teenager or in adult. I think that was the main problem. It was not in your differential. If it was in your differential, you will
true,
get it.
true.
Yeah,
Yeah,
this is I think the only maybe mistake that happened. Okay, because she was frank, she was telling you I'm fine, physically fine. Then if not physically fine, and she doesn't have eating disorder, which I know all of us will jump to the eating disorder bit of the things. Okay, then
yeah,
what is left? Okay, so psychological. So psychological, if you ask her, she says, "We are a happy family. Everyone is fine there. I'm happy with my boyfriend." So what is left is only, drugs, and then
yeah,
confirming that there
yeah.
is nothing physical by the examination, bringing the patient in. Okay. I will give you your individualized feedback. I will just because that's the part of the things that will be in the YouTube. Okay. I will just close it. I will open another recording for your individualized feedback. But well done in general. Well done. I like your rapport. I like your, your train of thought and the asking. Okay, the rate was fine, but the timing needed to be fixed, and we'll
We'll see.
speak. We'll talk about that just in a minute.